A 55-year-old who is having alcoholic cirrhosis along with portal hypertension started to have hematemesis. Why hematemesis occur in case of portal hypertension? What is the anatomy of the portosystemic anastomosis in cirrhosis of liver? So you should remember that when the liver typically becomes cirrhotic, it becomes very difficult for the portal vein to drain into the liver. So those offshoots of the portal vein form an anastomosis with the systemic circulation formed by the vena cava. So it is the portosystemic anastomosis wherein you have a left gastric vein and the esophageal vein, they both form the varices around the lower part of the esophagus, which is the source of bleeding. So it is the left gastric vein, the part of the portal system, and the esophageal veins, which are the part of the systemic circulation, they both form a portosystemic anastomosis is what you need to basically understand. One of the hormone activates the phospholipase C, leading to the release of the calcium, and the calcium in turn will cause an increase of which other important secondary messenger is the question of the examiner. So you should be very sure that phospholipase C, inositol triphosphate, and the ligand gated calcium channel, so these are all interrelated to each other. So the answer would be the inositol 1,4,5 triphosphate is the one which is implicated in this cascade of reactions is what you need to basically remember. A 5-year-old girl falls and she is removed from the water, and what mechanism, homeostatic mechanism, maintains the core temperature of the patient? It is the shivering which typically maintains the core temperature is what you need to ultimately remember. 39-year-old woman comes to the physician and her 24-hour urinary collection shows that her epinephrine, metanephrine levels are high. So fundamentally it is a case of pheochromocytoma. So pheochromocytoma arises from the chromaffin cells. Then what are the tumor markers or the surface markers, cell markers of chromaffin cells is a very important question. Chromogranin, synaptophysin, neuron specific kinolase, they are all considered to be the markers of the pheochromocytoma cells is what you have to ultimately remember. Now you have done an experiment where there is an abrupt increase of the perfusion pressure to the kidney, but within 1 minute it will come back to the baseline, and after that it will have a slight elevation and maintains it. So what is responsible for all this? There are autoregulatory mechanisms that typically maintain the perfusion pressure, especially to the critical organs like brain and the kidney. So this is a classical example of what is called autoregulation is what you need to understand. A 16-year-old, he has got a normal liver enzymes, negative Coombs test, but the mean corpuscular hemoglobin is increased and osmotic fragility is increased. So what do you expect? Typically you expect spherocytes. Very, very, very important question in the exam. What type of hemolysis is the hemolysis that you see in the case of the hereditary spherocytosis? It is not autoimmune. That is the reason it is typically Coombs negative hemolysis is what you typically see in case of the hereditary spherocytosis is what you have to ultimately remember. 34-year-old is brought to emergency because of the confusion, and her serum glucose levels are as low as 25, and after you have given infusion of a 25% dextrose, she regained consciousness, This is the typical history of hypoglycemic attacks relieved by the glucose infusion. SMOGI symptoms, they are called as. Typical feature of insulinoma, as all of you know very well.